Your spine is always working for you. Shouldn't you be taking good care of it? My name is Marla Crago, PT, and I'm the owner of Element Physical Therapy here in Missoula. I've designed this program to help teach you about your spine and how to take care of it so you can feel good and function well. Since 1997, I've been working with patients who have neck and back complaints, and many of them are helped by simple changes at work and at home. In order to know how to take care of your spine, it helps to learn about the anatomy, or what the spine is made of. There are over 200 bones in the human body and over 600 muscles. The spine itself, which is the core center of your body, is made up of 7 cervical or neck vertebrae that attach to the skull and support the head, 12 thoracic or mid-back vertebrae that serve as attachment points for the ribs, and 5 low back or lumbar vertebrae, and the sacrum and coccyx, which make up the tailbone. Attaching to each of these bones to the next one is called a ligament. Attaching to most bones are several muscle groups. In between the upper and lower vertebra is this facet joint right here. In the front, there's a cushion in between the upper and lower vertebra called a disc that acts as a shock absorber. The whole spine acts as protection for the spinal cord and nerves, which exit out here and go down into the limbs, controlling sensation and movement. You can have problems arise in any number of these structures, so it's important to be evaluated by a professional to determine exactly what's causing your particular problem. Some danger signals you should watch for: severe pain with no obvious cause, gradual onset or worsening of symptoms, pain that lasts more than 3 weeks, shooting pain, numbness, or weakness in the limbs, pain that persists despite resting, sleep, or changing position, pain that's accompanied by fever, chills, nausea, or sudden gain or loss of weight, kidney, bladder, or bowel problems developing, or impaired sexual function occurring. If any of these occur, please seek medical attention. The information presented here is not a substitute for evaluation by a medical professional. If you are having a problem which requires treatment, seek assessment by a physician or an appropriate specialist. This program is entitled Be Safe. Be Safe is an acronym that stands for Body Mechanics, or how you use and position your body, Ergonomics, factors outside your body including environment and equipment, Strength, needed in all appropriate muscle groups in a balanced pattern, Adaptability, including balance, agility, and your ability to switch to new tasks, and Flexibility, to avoid strain and get in appropriate positions. Last, Endurance, to avoid overuse, repetitive strain, and fatigue. Most of my presentation will focus on body mechanics, or how you use and position your body. The first and most important thing to learn regarding your spine is proper posture. Ideal posture is something we call neutral spine. I'm going to have you do a little experiment with me so you can feel what neutral spine is like and what ideal posture feels like. Starting down at the feet, I'm going to have you spread your toes wide and plant them on the ground until you feel like you have a good solid base of support. Shift your body weight forward and backward until you feel like you're centered between those 2 points, neither forward nor backward, but right in the middle. Then take your feet and tilt them towards the outer border and in towards the arch until you feel like you're centered between those 2 points. Your knees should stay relaxed, not locked back in place, not bent, but just soft and relaxed and comfortable. The pelvis can be centered using a similar technique. You can tuck your tailbone under and then stick it out and keep going back and forth until you feel like you're centered between those 2 positions, neither forward nor backward. It helps if the abdominals stay a little bit braced and firm. The shoulder blades, which sit forward on so many people, should be back and towards the spine, staying away from your ears. Once you have this half of your body ready, then you can move your neck. You can pull your head back until you feel like your ear is right over the top of the shoulder and your head is centered over the rest of the body. This position may feel a little awkward to some of you. If so, you may have some of the abnormal positions shown here. Sway back includes excessive curvature in the low back. This can occur in people who are overweight, especially that carry weight in their abdomen, pregnant women, and people who do activities with a lot of impact to the spine, such as gymnasts. Flat back is a common position seen in people out of the military. It's a lack of curve in the low back. Kyphosis is excessive curvature in the upper spine or the thoracic spine, often accompanied with forward head posture. This is common, especially in women with low bone density, but can occur in inappropriate posture in all populations. With sitting, you should have a chair with good back support, a solid seat base so you don't sink in. In other words, avoid using overstuffed chairs or recliners. The chair should have a backrest to support your natural low back curve without creating too much pressure. If your chair doesn't have this, use something like a rolled up towel or sweatshirt to place in the small of your back to create that support. Knees should be level or slightly higher than the hips. And you can use a footrest if this is comfortable. You should leave 1 to 3 inch space behind the knee so that you're not cutting off the circulation in the lower leg. Sit on the tripod or between each sit bone and the pubic bone in the front. Avoid slouching or sitting on the tailbone, and also avoid holding your head forward of your shoulders for any prolonged period of time. Armrests should be at or slightly above the tip of the elbow so you can rest your arm comfortably and relax. For computer users, you should use a headset or a shoulder rest on the phone to avoid having your neck kink to the side. The monitor should sit 15 to 19 inches away from your body, and the top of the monitor should be just slightly below eye level. If you look at typeset frequently, use a document holder angled at 30 degrees to hold typed materials, and avoid looking down and holding your head forward. You should move or stretch every 30 minutes to 2 hours. This is especially important if you're sitting during driving on a long trip. There are a few different activities that tend to be very tough on the spine in a standing position. One of those is moving furniture. If you're going to move furniture, you want to make sure and get your center of gravity or your core as close to the weight and the mass of that furniture as possible. Drop yourself down and get your leg in a position that it can do the pushing for you. It's always better if you can use your body momentum to do the force of the push. It's better to push rather than pull if you're able to, and use your legs rather than your upper body if you can. Another thing that people will tend to have problems with is vacuuming. And it sounds silly, but it really works well to dance with the vacuum cleaner. If you hold the vacuum in front of you and pivot your foot forward and back and follow along with the direction that the vacuum cleaner is going, it's going to be a lot easier on your spine than standing in one spot and twisting as you move the vacuum cleaner. The last thing that gets people into trouble is lifting. When you're lifting, you want to make sure you can face the object that you're going to be lifting, so clear anything out of the way that might put you in an awkward position. Test the weight of the object first to make sure it's not going to be too heavy for you to do by yourself, and if so, get help. You don't want to risk injuring yourself to move something that 2 people can do safely. Stagger your foot position. So one is forward and one is back. This gives you a good stable base of support to catch the weight of the object when you do the lifting. Drop yourself down again so that your center of gravity is as close to the object as possible. Studies have shown that a 5-pound weight held right here next to the body puts about 10 pounds of pressure on the discs in the spine. If you take that same weight and you hold it out at arm's length, it puts about 500 pounds of pressure on the spine. So it's always better to keep things nice and close if you're going to be lifting or carrying. Then what you want to do is make sure you're using your legs to do the lifting, not your upper body. And this applies for putting the object back down again. Get that staggered foot position, keep it close, and drop down using your legs. Those things will help protect you when you're doing lifting. If you're lifting something that is a little awkward, reposition the weight so that it's centered and it's in a good position, or redistribute the load so you can carry smaller portions. If you have a little weakness in your legs, you may find it helpful to lean on something like a chair or your thigh to get down, even kneel on the ground if you need to. Get that object nice and close, and then use an arm to help with the pushing. Lifting a light object or something that might be in an awkward position, say behind a piece of furniture or down in the trunk of your car, you can use something called the golfer's lift. Golfers will tend to do this when they get a ball out of the cup. They'll rest their hand on top of the golf club. You can use a piece of furniture. And then they kick the leg out behind them as they go down to pick up the object. That little move of kicking the leg back behind helps keep your spine in a neutral position so you're not flexing at the waist. Because flexing, especially combined with twisting, is almost guaranteed to give you a back injury. It's very stressful on the joints. So using a few of these things should help make you safe when you're lifting. A good night's sleep is essential for feeling good and functioning well. Many people have trouble sleeping. Something that helps is to get a good, firm, supportive mattress, something that sinks about 2 inches when you sit on it. You want it firm, but not so firm that it puts pressure against any bony parts when you're lying down. You also want to try to maintain neutral spine. That means neutral front to back and side to side. So your pillow is going to be essential. For people who like to sleep on their back, you don't want a pillow that's too thick or your head sits in a forward position all night. So have just enough support under your head to maintain that neutral spine and a little bit of support behind your neck to maintain the curve. There are several pillows available, some that have a curve built into them, some that are down that you can tuck in to conform to the curve of your neck. Find one that works for you. Experiment a little with the pillow position. For sleeping on your back, it may be helpful to get a pillow under your knees. Getting in and out of bed is a lot easier if you roll onto your side first and then let your body roll into bed. This pillow is a little too thick for me. All I need is some support under my neck, so a rolled up towel works well. That supports the curve of my neck and allows me to lay without any strain on the neck area. A pillow under the knees helps keep your spine in a neutral position. If you don't have a pillow, your back will tend to arch up and create some compression. So tucking a pillow underneath your knees allows you to relax and maintain that neutral position. If you like to sleep on your side, then you want a pillow that is a little thicker. Your head should stay in a neutral position. You have a space between your shoulder and your head that needs to be filled in with the pillow. Imagine a line running from the middle of your forehead down through your chin. This should line up with your breastbone. So if you have a pillow that's too thick, it's going to cause you to be stretched at night. If it's too thin, your neck is going to get compressed the opposite direction. So have one that fills in the space between your shoulder and your ear and has a little bit of support, curvature in the side. Another thing that's helpful for side sleepers is to use a body pillow. Body pillow is a full-length pillow, like this one, that you can rest between your knees. And it's nice as well because it allows your upper arm to rest and be supported and opened up. If you like to sleep on your stomach, which I don't recommend if you have neck problems, you may want to consider going to a thinner pillow or none at all. Leaving the body pillow in place will allow you to lie at a quarter turn. And this allows your head to rest in a more comfortable position. If you're flat on your stomach, your head's going to be rotated to the side all night, and that can be a lot of strain on the neck. If you do like to sleep flat on your stomach, get a pillow to support your spine. Laying flat creates a lot of curve in the low back and compression. Getting an extra pillow underneath your hips can help with that. Something else that can help is tucking a pillow underneath your feet to help your spine flatten and be in a more comfortable position. Always try to keep your head forward rather than rotated. Ergonomics are anything outside of your body that affects how efficiently you can do work. These include things like adequate lighting, non-slip flooring, comfortable clothing. Equipment that works properly, is well oiled, well maintained. It's all of those things that surround you. The height of your chair, the height of your desk. Things that you don't directly influence but can have a large impact on you. Several things contribute to proper ergonomics. A few principles to keep in mind are demonstrated in the following. Some principles that help ensure good ergonomics. Think first. Plan ahead for your activities and make sure that you have the appropriate equipment, the appropriate help, and aren't going to have to put yourself at risk for injury. Assess the environment and the task requirements. Make sure everything is safe. Can you do this more safely? Can you move something into a better position? Keep your back flat. You want to get in that neutral spine position or do a pelvic tilt and brace with your abdominals, especially if you're doing anything that involves heavy lifting or moving. Keep straight. Face the job or the task at hand. Avoid forward bending at the waist or the neck, and minimize twisting of the spine. If you have to sit in an office chair, for example, it's better to have a swivel so you can pivot the whole chair rather than twist your body. And use your spine last. Use assistive equipment if available. Get a dolly or a cart instead of carrying a heavy object yourself. Get the job close to your belly. Keep everything close to your core or center of gravity. Movements should occur in the limbs or with the whole body and not just the spine. Try to get objects into a good position by pulling or moving with your arms and legs, then use your spine last. Keeping these things in mind will help ensure that your ergonomic setup isn't causing you problems. If you have difficulty with ergonomics at work, consult your safety officer and get some help. Strength is another thing that helps ensure good positioning of your spine. You want to have strength, of course, in your back muscles, but also in your abdominals. You want to have strength in your chest for doing pushing activities, and also in your shoulder blades for maintaining good posture. Your neck muscles should have some strength as well. Many strengthening activities can help keep you in good shape. A physical therapist can guide you on an exercise routine to ensure that you have good balance front to back and side to side so that your own muscles aren't creating the problem in your body. Adaptability is another factor that plays into spine health. That includes things like agility, balance, and your ability to switch from one task to another. If you have a body type that's more suited for marathon running than sprinting, you're probably better to be in a position or get into recreational activities that are suited for that, and vice versa. So match your body to the task or your task to the body. Flexibility is essential, especially in the hamstring muscles. Hamstrings tend to be a problem because they control what's happening from the pelvis down. If you have tightness in the hamstrings, you're going to have difficulty with bending over or squatting. Tightness here will prevent you from getting into a good squat position. So if you can maintain good length, you'll be able to do your lifting more efficiently. Another area that people tend to have a problem with flexibility is in their chest. That's why so many people develop forward shoulder posture, this rounded position. Women, especially larger breasted women, will develop that out of habit. Men who are muscular and do a lot of bench press develop it out of training. Either way, if you have a stronger chest than back muscles, you're going to be pulled into an awkward position. So make sure that you maintain flexibility in the chest for good postural position of your shoulders and neck. Endurance is the last piece to the Be Safe puzzle, and that includes thinking about things like doing difficult tasks early in the day so you're not fatigued, taking breaks frequently, every 20 or 30 minutes from a strenuous activity, or every couple of hours from a sitting position. You should alter your position to make sure that your body isn't getting fatigued and tired and at risk for injury. Maintaining strength, adaptability, flexibility, and endurance is something that physical therapists are very good at determining. I hope you found this presentation helpful. I tried to include a lot of information on taking care of your spine, but if you have neck or back pain, I know I didn't cover everything that might be troubling you. A thorough evaluation should be done to determine the cause of your symptoms, so an effective treatment plan can be designed for you. Physical therapists are trained extensively in evaluating muscles, tendons, ligaments, joints, and nerves throughout your body. We can work with your physician to determine if any other tests or treatments are necessary before starting a physical therapy routine. Therapists have many modalities and hands-on techniques that can relieve your pain. We can design custom routines, including stretches and strength training, as well as lifestyle changes to help you prevent injury and to be safe with your spine. Most insurances require a physician referral, so if you have any questions about coverage, please call us at Element Physical Therapy at 543-7860, and we can talk to you about what physical therapy can do for you. I appreciate you taking the time to watch this presentation. I hope you learned something about how to take care of your spine so that it can take care of you. Thanks for watching. Be safe.